I want you to hear me right now. I know what you've been told by your doctor or advanced practice professional, even with what your nutritional professional has told you. But the truth is, meat isn't the real villain behind your gout. We've all heard the story. Red meat causes gout. So if you have high uric acid, better kiss that steak or lobster goodbye, right? Well, not so fast. Today I'm going to show you why that idea is outdated and what the real culprits are behind painful gout flares. In this video, we're going to unravel the surprising truth about uric acid, inflammation, and why you can enjoy red meat again, even if you've battled gout in the past. And if you hang in until the end of this video, I'm going to show you real case studies of patients who reverse their gout on a carnivore diet. Yes, red meat and all. Plus, I'll share how to safely transition into low-carb eating if you're prone to flare-ups. And if you're new to my channel, I'm Dr. Tony Hampton, a board-certified obesity specialist, family doc, and a metabolic health champion. I'm here to help you challenge conventional thinking and get to the root causes of chronic illnesses, so you can live free from fear, inflammation, and of course, prescriptions. Let's start by addressing what's likely been one of the biggest concerns if you have gout. Red meat and shellfish are high in purines. And yes, purines do break down into uric acid. But here's the truth. Not everyone with high uric acid gets gout, and not everyone with gout has a high purine diet. Why? Because uric acid is only part of the story. The real issue isn't purines, it's inflammation and metabolic dysfunction. So unless you're a walking uric acid crystal, red meat alone isn't going to launch a gout attack, especially if you're metabolically healthy. Let's talk about the two biggest offenders in the modern diet. Number one, fructose, especially from sugar and high fructose corn syrup. Fructose increases uric acid production in a unique way, without involving purines at all. When the liver processes fructose, it burns through ATP, leading to a cascade that spikes uric acid levels. Number two, high insulin and metabolic syndrome. Insulin resistance reduces the kidney's ability to excrete uric acid. So even normal production levels can become a problem. Think about it. High sugar leads to high insulin, leads to poor uric acid clearance, which leads to gout. That's the real story for most people, not the ribeye. Here's the part your doctor might not have told you. You can have high uric acid and still not get gout if inflammation is low. Gout flares require a second hit, something that tips the immune system into overdrive. And what's the most common second hit? Systemic inflammation. But a well-formulated low-carb keto or a carnivore diet reduces inflammation, meaning fewer flare-ups, even with higher purine intake. Let me tell you about 3 of my patients who reversed their gout using red meat. Yes, you heard me. They ate more meat and had fewer flares. Case number 1, a 62-year-old man with chronic gout and joint pain. After switching to a carnivore diet, he hasn't had a flare in over a year. Case number 2, a woman who used to fear steak. After going keto and then carnivore, she dropped her insulin levels, reduced inflammation, and her uric acid normalized without meds. Number 3, a former soda addict. Cutting fructose was the game changer, not cutting meat. The takeaway? It's not the meat. It's the mess that comes with a processed high-carb lifestyle. Now let's talk about the transition phase. When you first enter ketosis, ketones and uric acid compete for excretion through the kidneys. This can temporarily raise uric acid levels. Translation? If you're prone to gout and dive headfirst into keto or carnivore, you might feel it. But that's just temporary. Here are 2 strategies I use with my patients. Option number 1, the gradual slide. Ease into ketosis. Cut your carbs from 100 to 75 to 50 and to 30 over weeks. This gives your kidneys time to adapt without overwhelming them. Option number 2, the strategic jump with medication. Go full keto or carnivore, but temporarily use meds like allopurinol to reduce uric acid production, colchicine to prevent flare-ups during the transition by increasing uric acid excretion. Once keto adaptive, you can often come off these meds entirely. One more thing, consistency matters. If you keep bouncing in and out of ketosis, let's think about it for a second. Those weekend carb binges, for example. When you do that, you're reactivating the gout trap over and over. Every time you shift back into ketosis, those ketones compete again. Uric acid builds up, and boom, flare city. Either stay low carb consistently, or if you choose to flex, consider preventive meds during those windows. Here's the simplified science. When purines become uric acid, you're usually fine unless you have fructose and insulin resistance. And in that case, you'll have more uric acid plus less excretion. The other concept is that in early ketosis, you're going to have more urinary ketones. This is a temporary state until you become keto adaptive. Another concept you've learned is that inflammation leads to the real reason why you have flare-ups in the first place. But a low-carb keto or carnivore diet lowers insulin plus lowers inflammation. This leads to fewer flares. And boom, that's the real pathway to gout freedom. So if you've been avoiding red meat out of fear, breathe easy. Your body doesn't hate steak. It hates sugar, seed oils, and of course, inflammation. You don't need to give up the foods that nourish you. You need to give up the foods that hurt you. Remember, fix the inflammation and the gout takes care of itself. So if you found this video helpful, do me a favor and hit that like button and subscribe. Share it with a friend who's been blaming their steak for their swollen toe. And don't miss this next video where I break down how salt really affects blood pressure, especially if you're on a keto or carnivore diet. Trust me, it's not what you've been told. You don't have to suffer in silence or give up the foods you love. With the right knowledge and strategy, you can eat well, live well, and most importantly, heal. Stay curious, stay committed, and as always, continue to protect your nest.